I'm going to show you a few movements that you can do to test yourself at home to see how things feel from side to side. If you have any issues either doing these movements, holding the positions, or if one side feels different than the other, might be a good indication to come on into the office. The first set that we're going to do is focusing on our neck and specifically the range of motion there. So what you're going to do first, and I'm going to turn this way so it's easy to see, is we're going to take our chin down to our chest, and we should be able to touch it. Sometimes you'll feel pain going back in between your shoulder blades. A lot of people might not be able to reach quite to their chest, but it should be all the way flat. The next one that we're going to do is the opposite, so we're going to extend backwards. We're aiming for an 80-degree angle here, and you should notice when you look in a mirror that you see multiple skin folds in your neck. That actually indicates that we're moving properly throughout our whole cervical spine, and we're not just getting all the movement at one segment. So we did flexion, and now we're going to go into extension. Again, seeing how that feels. And then the last one that we're going to do is rotation. So the goal here is to be able to turn from side to side, and we're aiming for our chin to land above our clavicle or our collarbone. So if you kind of feel that bone that runs across right through here, our chin should be able to clear that as we turn. The next test that we're going to do is focusing on our thoracic rotation and thoracic mobility. This is really important for people that sit at a desk all day, cycle, the list goes on. So what you're going to do is sit in a position where we're about 90 degrees at the knees. We're going to place something in between our knees. In this case, I'm going to use a foam roller. You can use a medicine ball, a rolled up towel, anything to really engage the legs. Because what that's going to do is kind of lock out the lumbar spine, which we're not trying to test here. We're trying to test the mid-back. So we're locked in here. I'm going to bring my arms up, and we're just going to rotate to one side, and we're aiming for a 45-degree angle there. And same thing on this side. So you're going to pay attention to how far you can go, but also how it feels from side to side. Does it feel the same? Is it harder one way than it is the other? The next thing that we're going to do is test our core strength. Core strength is really important in preventing issues with the lower back as well as a cascade of things. What we're going to do is a side plank and see how long we can hold it. I'll post the normative values for your age range and your gender, but we're kind of aiming for that 30-second range is what it's mostly around. So for the side plank, you're going to come down on your forearm. You're going to extend both of your legs and stack your feet. I like to do my hand on your hip, and then you're going to come up in a nice straight line and hold. We're going to do the same thing on the other side. Again, comparing how does it feel, how long can you hold it, is it different side to side. The last one that we're going to do is for our hip rotation. So in a second, I'm going to lay down, do like a figure 4. We're going to see how far up my knee is from the ground. The goal is for your knee to be within 2/5 this distance from the ground. And if it's not, that can indicate some tight hip flexors.
Here you can see me lift up my right leg and set the foot on my left thigh. And I'm just trying to relax down that right knee. But as you can see, it was pretty high off of the ground. Same thing for my left side. My knee should be able to come down a little further.
If any of those movements fell off or limited, give us a call and we're happy to help.